in the classroom. We have to have that hands-on supervised practice experience guided by that expert in the field. So I'm going to go ahead and share my screen. Sorry. Well, you have to, are you all seeing the full PowerPoint now?
Yes, please. It's on now.
Great. Okay. And it is advancing, correct? Advanced. Okay, great. Wonderful. Thank you. So we'll begin with first, what is a preceptor? And a preceptor is a teacher, an instructor, a guide, or mentor. A preceptor is an expert or specialist who gives practical experience and training to a student. Today I want to discuss the value of being a preceptor, understand what the dietitian nutritionist role is in dietetics education, provide characteristics of an effective preceptor, discuss the factors that impact learning and the implications for teaching, and just describe the components of a model for teaching interns. So my overall goal really is to increase our understanding of the students that we work with, their learning process, and how to improve our effectiveness as preceptors. So beginning with the value of being a preceptor for the hospital, we actually have several studies that have shown that there are direct benefits to the facility that sponsors dietetic interns because of student contributions. So they may be working out, they may do some positions in the kitchen, they may do some screening of patients, teach a class that we as dietitians might not have been able to have the time to do. They may develop patient education material. So those are some of the direct benefits that the hospital can receive from having students in the facility. There are some indirect benefits that include hiring graduates. So I worked in a healthcare system for veterans, and we had several hospitals within that system that sponsored dietetic internships. And what we knew is that our graduates of the internship, they were ready to hit the ground running. They knew the hospital software and everything. So it was very easy for them to start work as a dietitian in our facility. There's also a certain amount of prestige that comes in being a teaching hospital, that it helps that indirect value for the facility. What about for the preceptors? Well, there are many professional benefits, including just the energy that the students bring with them. It really helps us stay current because of their questions, some of the things that they share with us that they've learned in the classroom. There is a prestige again, and recognition by the hospital that your profession is important enough and you are such a good dietitian that you've been chosen to be a preceptor. We see that being a preceptor increases a sense of satisfaction and achievement. It improves your own job-related skills, really enhances quality of patient care. And that learning process and keeping current, it really helps improve patient care. And it can assist you with getting some projects done, some things that you always wanted to do but didn't have time to. You can assign the interns to help you complete some of those projects. So let's talk about how we prepare for that role of preceptor and the relationship that it incurs. So there is this relationship between the student, the intern, the preceptor, and the environment for which the two are in. So in beginning with the student, the goal for the student, what they're trying to accomplish is moving from novice to expert. And there's 3 areas of learning that are necessary to become an expert in the field. The number 1 is that acquisition of foundational knowledge. That foundational knowledge is often what we're receiving in the classroom. But the second part of that is mastery of professional skills. And that's then that translation. So that's what that looks like when you're going through a chart note, for example, and you're finding out what the diagnoses are and the medications. What does that mean? How does that translate into an intervention as the dietitian? And then finally, the third part of learning that's necessary is attainment of attitudes appropriate for one's role as a health professional. So it's all that professionalism that you really have to learn in the environment. So it's going on rounds with the medical team and paying attention and giving feedback when asked, or contributing to the knowledge of the patient. Those are important skills that are learned in a clinical environment. So the second part of that relationship is that environment. And the environment is really about acquiring and refining that knowledge, so that translating. And it's within a very different context. And again, in the classroom, they will have a case study, where in this environment, they have large numbers of patients. And these patients don't usually have just one disease. They often have multiple diseases. And then they have a lot of other socio-cultural considerations too. Do they have the funds to purchase the food that you're recommending? So it becomes much more complex for them. They have multiple professional responsibilities within that environment. And how do they actually make those techniques work? That's what the environment brings to this relationship. When we talk about that environment, and we as preceptors have a role in optimizing that environment. And when we think about what not to do, what we want to do is to avoid the awkwardness where they feel uncomfortable, they aren't oriented to their environment well. We want to avoid ambiguity. We want to have clear expectations that are communicated to the student. And if at all possible, we want to avoid an environment that is anxiety provoking. And, there is a good amount, if you remember back when you were a student going into the hospital for the first time, you do feel some anxiety. But we don't want it to be so much anxiety that it overwhelms them and they can't learn. And again, as the preceptor, we can help make sure that we don't have an environment that's too anxiety provoking. Sometimes it's us that are doing it and having check-ins with the student to see how they're feeling is very helpful to the learning experience. So as I said, the goal is to move students from novice to expert. And many times when they enter this environment for the first time, they have a reality shock. And that's a term that's used to describe this reaction when students, walk into the clinical environment for the first time, and it doesn't really necessarily match what they thought it was going to be, the values that they anticipated. And they can experience a lot of different emotions with that. So often we'll see when they first come into the environment, there is like this honeymoon. They're fascinated by the newness. They think everything is wonderful. And what we can do to help with that stage is just be realistic, but don't stifle the enthusiasm. They say, oh, I went and saw this patient and they seem to take every suggestion I had. Don't say, oh yeah, well, not every patient's going to be like that, or sure, they said that, but they're not going to do it. We don't want to stifle that enthusiasm, but we want to be realistic. Then they may often go into this shock or crisis where they feel the kind of negative that, well, why didn't they tell me this in the classroom? I don't understand why this is like this. So this, as a preceptor, is an opportunity for us to be a good listener and allow them to vent about their experience, process it with them. Then we move to recovery, where they start to, the tension lessens a little bit, and we can help support by the development of critical thinking. So yes, that environment might not be what you thought it was going to be from the classroom, but now I'm learning ways that I can work through that ambiguity, that distance between reality and what they thought was going to happen. We can help them critically work through that, so that then we align with what with what they want. And finally, resolution is when that conflict is resolved and we continue to help a student with constructive problem solving around these issues. So we often think as a preceptor, well, we're there just to teach them, but we actually have several roles as a preceptor. And we're going to talk about those as role model, socializer, and educator. So a role model, you set the stage for what they expect of a dietitian. You demonstrate and personify the skills and competence in practice. You model ethical and professional behavior, and also demonstrate that commitment to self-learning, keeping yourself up to date and teaching others. We also play a role as socializer. As I talked about that environment, we want to minimize ambiguity, awkwardness. Well, as a socializer, we want to orient them to the work setting, introduce them to the charge nurse and the other staff members that they're going to work with. Show them where they find the chart notes, and maybe where they find the nursing notes, where like for intake and things like that. Even show them where the facilities are so they feel comfortable, and help them with that integration. It can be when you're on rounds, for example, the doctor might ask a question and you can say, well, you know what? My student was working with that patient this morning. Let's hear what she has to say about that student, and help facilitate that relationship. We want to socialize the preceptee to the culture and value system that comes along with being a profession and what our standards are. And then, of course, the biggest role is that of educator. So we're the expert and the teacher. We want to discuss expectations about the experience, assess their learning needs. Some students are farther along than others. Kind of talking to them about what their learning style is. What's the best experience they've had so far, and why? So that you can help, tailor what you're doing and those expectations that come with that. You want to plan learning experiences to meet the competencies. At least from the University of Ghana, we have new logbooks that show the competencies, but we also have examples of those learning activities to fulfill those competencies. you as a preceptor, if you ever have any questions, that's what the educators at the university are there for, to help you. You shouldn't have to be struggling with finding certain learning activities. It should be things that you are doing within your work. So educating, assessing, providing counseling. And then as an educator, a very critical part of that role is to give feedback so that we can help the students grow in their skill set. We're going to talk a lot more about that feedback process in just a few minutes. So think about, in your experience, what made up, who was the worst preceptor? And if you want to put in the chat box, share some characteristics of the worst preceptor that you had when you were training. And Prince, maybe you can help me monitor the chat box. Characteristics of the worst preceptor. Do you want me to start calling on people?
All right. So Sam says it's easily agitated. Frank says self-centered, least provocative.
Those are good. Arrogant.
Authoritative.
Yeah, too authoritative.
Not
demeaning. Keep going.
Yeah.
We got that.
Great.
Yeah, I heard a lot of those when some of what we talked about, and that the best environment, if we are being demeaning or too authoritative, we're going to really squelch that environment of learning, and you can really see a student shutting down from that. So what about the best preceptor you've had? Oops, sorry. Oh, shoot. That's showing again, right, Prince?
Yeah. So colleagues, please, you can send in your answers of the best preceptor you've had. You can write what's okay. So Sam says very welcoming, understanding and cooperating.
Love that.
Friendly. Willingness to teach.
Those are great.
Empathetic.
Empathetic. Nice.
Humble.
Those are
sensitive. Accommodating. Ready to listen.
I love those showing that patience, respect for the student, challenging them but not overwhelming them, being positive about the profession, being patient. I love that one. Giving frequent feedback. And being positive about the student. If you don't want to have the student there, they'll feel that, right? So we want to be positive with them. Those are great. Okay, so now we're going to talk more about a model for planning this learning experience. And the phases, there are generally 3 phases of the preceptorship. First, it's establishing that relationship. Then you have the working phase. and finally the evaluation. And we're going to go through each of these phases. I'm going to try to give you some tips that will help improve that phase as you go. So the first phase is establishing that relationship. And really, it's critical that we establish trust, that the student trusts that you're going to help them achieve this goal of moving from novice to expert, that you are going to give constructive feedback. If they don't feel like they trust you, if you are, maybe changing moods on them and 1 minute positive and then kind of critical, that can really undermine trust. Then we want to make sure that what are the experiences, that what you're expecting of them, what they're expecting of the experience. And the log books are a very helpful guide, at least for beginning to talk that through. And so you can give them ideas of what to expect. When I had general medicine, I would always go through with them. Well, on the first day, I'm going to have you screen patients, but tomorrow you'll start completing an assessment. And by Friday, I would expect that you'll be up to doing 3 assessments by yourself in the day. So just some of those expectations. Learn a little bit more about the student. And I had given some background, what their career goals are and what they would like to get out of the experience. Maybe it's if I'll go back to general medicine again, but maybe they have a particular interest in diabetes or cancer. And so perhaps you could give them a few more of those patients rather than some general patients. But in that their learning style is important, and what their goals are. Clarifying, what your role is, perhaps what if you have a nutritionist on your team, and see where the student falls in there. And then again, orienting them to the setting. That's really important, so they know where to go and be comfortable and not feel awkward in that environment. Then we move into the working phase. And this is when we, as preceptors, are being looked to as role models. So we're modeling the professionalism, and we're also showing them the clinical skills and how we translate that science into actual practice. In the working phase, we're discussing and critiquing. So there's always informal feedback being given. So you could send a student to see a patient, you're observing their interaction, perhaps it's an assessment or it's an education, and then they come back, and that's a really nice time to discuss. So how do you think it went? Is there anything that you might do better? And processing it through. I always say, when you're doing that informal feedback, you're giving positives, always couple positive with a negative. I really like the way that you establish rapport with the patient. One thing I did notice is that you didn't ask about their home environment. What do you think? What do you think that might have been important to gather? So that informal give and take, positive with a negative, asking them how they felt the session went, and then helping them with those critical skills. And that's, I think, one of the biggest challenges we have as preceptors. We have that critical thinking. We know what, how to translate that. but many times they'll be really good at going out and getting the assessment. They'll get all the data on the medicines, the surgical procedures, the medical procedures, labs, and then they can't translate into so what, and that's one of the reasons I think the nutrition care process is so helpful, because it really takes them through that critical thinking. So we gather the data, and you can help them with this. But now, so what are the problems? What kind of problems do you see? And then talking through what are the problems and what would you prioritize as your biggest problem, or maybe the problem that envelops the others as well. And then from there, what is causing that problem? And then we will know that then the appropriate intervention by what the problem is, the priority, and what is the cause of the problem. And so now we are able to do the intervention. That's the critical thinking steps that seem so easy to us as experienced dietitians and nutritionists, but that is what is so critical in students moving from novice to expert. So here's a model for this working phase. And it's demonstration, rehearsal of content, feedback and correction, independent practice, review, and motivate. And so I'm going to go through each of those just to break it down. Demonstration allows the students to observe you, and you walk them through the steps, show them shortcuts, and stick to the need to know. So that a good example might be when you go and you're going to counsel a patient. Maybe it's a patient that's malnourished, and you're going to counsel them on high protein, high calorie foods, and increasing timing and these nutrient dense foods to build them up. So you're going with you have them observe you doing that counseling, and then you can tell them, here's what I found from the chart, that this patient is malnourished. This is what I need to find out from the patient. And this is what I'm thinking I'm going to recommend to the patient when I counsel them. But some of it is going to depend on my interaction with the patient. But you kind of walk them through. And so then they observe you doing the counseling, asking the questions, formulating the plan, counseling them. And then I recommend then you come back and help them, again, process. Well, they told me that they only like these foods, these types of foods. So that's why I put that in my counseling plan. So helping them understand the whys behind your strategies. And some of those shortcuts that you might take, and not helping them simplify and stick with the need to know. Sometimes we want to dump everything we know into them, and we need to stick with the need to know and build from there. So then after you've shown that they've observed you, then it's time for them to role play what you had them observe. So you're going to have them role play doing a counseling, going and talking to the patient and assessing them. So help anticipate any questions. You might, kind of say, when you go and see this patient, they're on a tube feeding. Look for where the tube is placed. Ask them how they're feeling. Are they having any GI issues or anything? The wife might ask you when, if the patient is going home on this feeding. So kind of help them anticipate what the scenario is going to be like, and then go with them and observe. This is the time to provide them the feedback and correction. And again, as I said, you can ask them their opinion, communicate your approval, and be open. And as I said, kind of that sandwich, something positive, and then something that they need to work on, and how they might do that, how that might be improved. Students really need to feel comfortable making mistakes, and that's what the being in supervised practice, why it's so challenging for students, because most of our students are really, really smart. They're used to getting A's, being almost perfect on their tests. But when you go into supervised practice, you learn by how? You learn by making mistakes and being given feedback and corrections. So sometimes I'll see preceptors that they'll ask a tough question, and then they'll just sit there and wait, and the student obviously does not have the answer. Don't let them struggle too long. Give them hints and guide them to the answer. Many times, if you just give them one hint, that'll bring back that knowledge, and they'll be able to answer. So don't let them flounder too long. And the next step is independent practice. Let them go, but be available, be there for them. Make sure your expectations are clear. I expect that you're going to assess 3 patients today, and have the notes written up clearly by the end of at this time in the day. Give them those deadlines again, and those expectations. Then review their work, looking at their notes, helping them see, well, you're really good at identifying the nutrition problem, the diagnosis, but sometimes I see that your etiology isn't as strong as it should be. So let's work on that a little bit. And here's what I was thinking as the etiology, or if they were having some trouble with their counseling, demonstrate that again. And you can role play with the student right there, or have them come and watch you do something. And so that you can help, you're modeling them, you're helping them form into that expert. Motivate. We all need affirmation, right? We need affirmation that we're doing a good job, that we're where at least we should be. And so make sure that you're giving them that motivation to keep working hard, and give specifics, not like, oh, you did a great job today. Well, what specifically did you do? This was a really good day. You saw 4 patients and your notes were very strong. I saw improvement in such and such. Give them real specifics. And then our final role is assessing our students' learning. And the purpose of the evaluation is to provide students with how they are reaching the competencies. And it also gives an opportunity for the preceptors to give feedback on how they're not meeting those skills or competencies. This is a challenging process for most preceptors, because we want to be nice, but always remember that when you're giving constructive feedback, you are helping them. You think about what your role is, and what your goal is to help them be the best, help them develop those skills to move to an expert. Then you know that you're doing the right thing when you give them constructive feedback. Evaluations can be looked at as a 3-act play: asking the questions, answering the questions, and then delivering the answers. So starting with asking the right questions, what are the measurement criteria? The measurement criteria should be directly connected to the program outcomes. So again, I'll take you back to the log books from the university, that they will tell you how many what the competencies they need to be meeting for this rotation. And then from there, we know that how we measure them meeting that competency, it isn't random. It's actually, this competency is met by performing these activities, assessments, counseling. Maybe it is developing an educational handout. The logbook should give you the criteria for answering, what was the measurement that I'm assessing. And then, so we know what we're measuring in them, and you aren't going by intuition. We're evidence-based practice, and when we evaluate, we need to be evidence-based as well. So what does the data show you? Are they meeting those benchmarks? Did they complete the number of assessments? Are they struggling with those linkages, the causes, the priorities? So as much as possible, use the data to support and communicate your evaluation of if they're meeting those criteria. And then, as I said, using those answers. So continuous feedback, that, and you can do it along the way, and it's very important to do it at the end of the day, wrapping up. You can even ask them, what do you think went well today? What are you most proud of today? And what do you think you need to, what was something from today that maybe you think you need to continue to work on? How can I help you improve? That continuous feedback, if you're giving it appropriately, constructively, it should match the final evaluation. Have facts to back up what feedback you're providing. Focus on behaviors, not the person, and give the positives, but be careful about trying to water down criticisms, and be sure that you give ways that they can improve. I find that sometimes those professional behaviors are harder to give feedback on than even clinical skills. So we sometimes, with generational differences, have challenges with our students interacting with other healthcare professionals or with the patients and the families. So giving specifics about, well, when you were on rounds today, you kept checking your phone, and that can be very distracting. It didn't seem to be related to, it didn't look like you were looking up any terms or medicines. It appeared that you were on WhatsApp or something. When you addressed the patient, you were not formal in the way that you addressed the patient. You were too informal, and that can be offensive to patients. So giving some specifics, but again, sometimes with professionalism, it's harder to give feedback on. But as much fact as you have, and then providing some suggestions for improvement, because at the end of the day, that's what our goal is. That's our mutual goal, is the student wants to be the best in their skills and professionalism, and you want them you want to help them achieve that. So I'm going to leave you with some final thoughts from preceptors themselves before we go into the questions. Tips from other preceptors: make students feel welcome, listen to what students need or want to learn, and don't always present what you want them to learn. Take time in the beginning to explain explicitly what will be expected. Get to know the students' strengths and weaknesses as soon as possible. Learn from your students. Give the students some independence. Don't rush the process. Encourage questions. Communicate. go step by step. Students can't learn shortcuts. They need to learn all the steps in the process. And when I sometimes with communication, I'll add that many times we know what we're doing here in our head, but you need to think out loud so that they can hear the steps of the process. Set clear goals with timeframes, and I love this. Have fun, enjoy being with that, with the student. So, friends, at this time, I'll stop sharing and I'll open it up for questions.
Thank you so much, Prof. We would wish that this one will continue for another hour. We've really enjoyed. I've enjoyed the presentation and the nuggets you've shared. Some hands are up already, so I know that there are more questions. Please, you can raise your hand if you want to ask a question, and also you can send your question in the chat box, and it will be read for you. So I have Eric. Eric, can you please kindly unmute and ask your question? Eric. Hello, Eric.
Hello, please, can you hear me?
Yes, we can hear you now.
Okay, all right, sure. Sorry about that. I was asking if you have any structured training model you use in training clinical students you can share with us. That's the first one. And beyond this presentation, are there any resources you can share for us to learn as preceptors in terms of improving ourselves and the work we do? And the third one is, how would you advise a student whose career goal is not to end up being a professional dietitian? He or she's probably just going through the ties to fulfill all righteousness, but not necessarily to become a professional dietitian. How would you handle a situation like that? And the last one, in providing feedback to students, how would you handle a situation where students have inflated views of their competence, but you want to still communicate it in a very helpful way so that you don't also, in a way, discourage them? Thank you very much.
Yeah, thank you, Eric. I think for the first two, what I would, I wish there was more on like handbooks and things. I will share this PowerPoint with you because I think it does have some models that you can go through. I encourage for follow-up learning on is to perhaps, if you're at a facility, that you can have a session with some of the other dietitians that are serving as preceptors, and have a session where you talk about, you know, some of the challenges that you're having and get feedback on from the other preceptors on, well, this, you know what, I had this experience and this worked for me. Giving each other tidbits and suggestions that can help you be a better preceptor there too. Also, getting feedback. I think it's important that and the university shares some of that feedback that they receive from the students. And sometimes that feedback can smart a little bit, but you know, it is important to get some feedback. And if you start to see themes on maybe some areas that you need to work on, maybe there's a theme that says, you know, Eric didn't make us feel very welcome. So how do, you know, looking at yourself, how you might be able to do that, or work with another dietitian, say, well, you know, I got this feedback. How do you create a more welcoming environment? That's just an example. Eric, I know that you're very welcoming. It's always a tough one when you get students that those rare students that really don't want to be there, that they're there because of maybe family pressures or things like that. And sometimes when you're so busy working and you're taking the time to help someone, to teach people, and then you almost feel like they're taking advantage of your time because they're not even going to be dietitians. Sometimes what I say is, you know, I know it feels easy to kind of pull back from them. But I think that if you show them that how they show that if you show them your passion, you might change, you know, how they view that. But I do think that there's a clear, that you set a clear expectation. You know, you may not want to become a dietitian, but you have been assigned to me, and we're going to have a full rotation. And I expect that you show the respect to me and the profession that it is warranted. So, you know, no eye rolling or, well, I don't want to do this anyways. You know, that's not acceptable. That's not. And then you set that boundary with them. At the end of the day, they still have to complete the rotation to the standards that is expected of all students. And, you know, but I think, you know, showing it, you know, still being positive. And I would almost want to be more positive about the profession. You know, wow, that was really exciting to see that patient change and, you know, to gain weight back or something like that. So those are just some thoughts that I have. Oh, the last one, you gave me a lot to answer. The last one.
Yes.
Oh, when they're overinflated. Oh, that's a generational thing. And when I did longer preceptor trainings, I talked about the different generations and those differences. And some of the generation that we're getting right now, that is more common than I've ever seen it, is that they have an overinflated sense of their performance. And so that, I mean, you know, again, it's facts. So, you know, you felt, you know, you ask them, how do you think you did? And they say, oh, I did great. You know, that counseling session, I did so well. And I, you know, I think you have to be, you know, not Debbie Downer, but, you know, it's, well, you know, there were some things I thought you did well, and you can give them a couple of those, but let me point out some other things. When you were talking about these foods, for example, the patient had a change in their face, and they told you that they had a limited income. So they're not going to be able to purchase those foods that you recommended they did. And so in the future, I would recommend you listen to your patient more and adjust the recommended foods based on those things that you heard, like economics. Also, I noticed that the patient looked very confused when you were talking about what kidney disease was and why protein needs to be restricted. They seemed very confused. And I think by your demeanor, they didn't feel comfortable asking a question. So pointing out real specifics, I think can help kind of, I don't want to burst their bubble, but give them a more realistic view of their performances.
Thank you very much, Prof. Someone is asking, how do you point out how do you help disrespectful preceptees without offending them?
If they're disrespectful, they need to be called on that behavior. That's not professional behavior. Are we going to be disrespectful to physicians or nurses or patients? No, that's unacceptable. And you call them on it, and you also tell the university, you know, that behavior cannot continue. That is you know, there are things that we want to meld them and build them up and help them develop skills, but disrespect, nope, not acceptable, not, you know, so I'm sorry, I'm gonna have to stop you right there. That was very disrespectful, and that behavior cannot continue, and I will be talking to your professor about that. I'm sorry, you know, what you're giving as a preceptor is so valuable, and that you should be treated only with respect.
Thank you so much.
That was kind of a hot button for me.
Yes, I think we can relate very well, even from a cultural point of view. Before I go on to the next question, the question about those who will tell you, I'm not even going to take this anywhere, I'm not going to practice as a dietitian. I had two interns who kept on, they kept on repeating, we will not practice as dietitians, this job, this profession doesn't pay. And we kept on encouraging them. Sometimes it was just very discouraging. And they didn't even finish, and they started asking and inquiring how they can be employed as dietitians and those. So I realized sometimes they don't know much in the real world. They fantasize some jobs they want to do, but then when the reality actually hits them, they realize that after all, the profession isn't as bad as they had envisaged. So I would say that we as preceptors, we may have to just look at the other side too, that they may change their minds. So we still have to do what we do for them, and later they may come back to appreciate and thank us. All right.
Yeah, Prince, I would add that goes back to that reality shock, right? And different stages that they're in, and that we can help them through that. In the States, it seems like you get one of the most common ones was, oh, I'm going to be a sports dietitian. I don't want to work in a hospital. I want to be a sports dietitian. Yeah. And helping them see that that's a great goal. Not many jobs out there, but it's a great goal. But you know that the foundation, you as a sports dietitian, you really have to know your medical nutrition therapy, because you're going to get a lot of challenging situations with electrolyte imbalances and such. And so, kind of bringing them back to that reality is, you can't have that glamorous job without having this foundational knowledge and ability.
Yeah. So from Seram, great information. Are there any guys as to how to handle students and preceptors to avoid using phones on the job? Because it looks like more and more health professionals are becoming too glued to their phones.
Glued to their phones. Well, yeah. It's interesting because in that 2-day training that I gave, there was some important points made about the phone, and something that I hadn't thought of as an older person, an older dietitian, but many times this generation especially is looking up meds on their phone, or a diagnosis on the phone, or terminology that we assume that they're looking, that they're on WhatsApp or Facebook or whatever. And so calling them on it, say, I saw that you were on the phone. To me, that looked like you weren't paying attention to what was going on. Could you explain to me what you were doing? And give them an opportunity to say, the doctor just brought up this term and I didn't know what it was, so I tried to look it up real quick. You can give them the benefit of the doubt, but call them out, because you can say, I understand that I compliment that you wanted to find that out, but just be careful, because it looks disrespectful. It looks like you're not paying attention, and especially with patients. I mean, that's just no. I mean, you might want to look up a food they said, but But to a patient, that's not giving them your 100%. So, you know, calling them on the behavior and explaining to them what the appearance it is. It's disrespectful to patients. It's disrespectful to me, you know. Yeah, but the phone, boy, yeah, everyone's connected to the phone.
All right. So you said that, especially when we ask a question as preceptors to the preceptees, and they are struggling to answer, we don't have to let them struggle for long. We may have to meet them halfway and lead them to the answer. Sometimes, as preceptors, sometimes in our minds, you have to let the people know you know your stuff. So you may be tempted to ask a few questions for the student also to know that they don't know much, and that they will have to humble or be relaxed to learn. What would you say about that to us as preceptors? This strategy, yeah. I
mean, that actually, like, if you're asking questions to show off how much you know, that's kind of demeaning. You know, you are the expert and you need to be confident in your skills. That's why you were entrusted with this student, is because you are an expert. And I know sometimes some people get a little offended or thrown off when students ask questions, and we encourage students to ask questions, but sometimes people feel like, oh, well, they're challenging me or something. And sometimes you do have one of those students occasionally that is challenging you, especially when you're a younger dietitian. Many of you know that my youngest daughter is a dietitian now, and she had a student, the first year she had interns, she had one young man that just kept drilling her with questions, and it was clearly kind of a challenge. Well, you're a young dietitian, you don't know anything. Those aren't very common, but that you don't feel confident enough in yourself that you have to feel better about yourself because by making the student feel less than that. I think people need to look at their motives and really go back to, you are the expert. You are an expert and you have a lot to give. But the way you give it can either facilitate or hamper the learning process. And that behavior probably isn't the best way to facilitate. But I will go back to what I was saying about those questions. Sometimes the students just get intimidated, and you can have a couple different approaches, and it probably depends on the student. Sometimes students are being lazy. They're like, nah, I don't know. Well, okay, if you get that feeling that they're just being lazy, then you need to look that up and bring that back to me tomorrow when we start the day. Because, maybe it's in pre-work that it's obviously they should know this, or it was in work that you gave them previously and they're just not trying very hard. Then I say, send them home and look it up and bring it back to you tomorrow. That's the expectation. But if it's coming from a place of they're intimidated, I always think that I'm not very intimidating, but sometimes, even recently when I was in Ghana, sometimes I get the deer in the headlight, and I knew I was overwhelming them. So I give them a little bit of time to try to think through, but then it becomes that obvious that they just can't pull it out right now. And so, but you feel like they know it. So you can do a little bit of hinting and see if they get to that. You have to make that final decision. We don't want to spoon feed them because they don't grow from that either. So it's this balance of, what is it? Are they are they overwhelmed, intimidated? Do they really know it? Then we can help get them to it. And if you help them get to it, then there's that satisfaction, that you know, that boost when, oh yeah, I remember now, it's vitamin C that helps iron, you know. So rather than just giving it to them, then they don't get that confidence boost. So it's hard. You have to evaluate. If it's somebody being lazy, make them look it up. But it is an opportunity to help them build up by a little bit of guiding too. I'm making it more complex. I'm sorry for such a long answer.
All right, I think it's great. RD Daniel Mensah said, from the training institution's position, how do you ensure the preceptor is meeting the training objective beyond just filling forms and ticking boxes in the student's login?
Well, from several things. I mean, we have like clear criteria. You know, some institutions have a minimum amount of time that they have to have been a dietitian before they could be a preceptor. We always are looking at their CV to see, you know, how long they've practiced, where they've practiced, getting feedback from the hospital or facility on, you know, who are your strong dietitians in this area, or and then we almost all institutions will look at continuing education, that you're getting continual development of your skills, and then finally having some feedback. The interns evaluate the rotation and the preceptor, so we're looking for themes again of, you know, well, this dietitian really didn't seem to know anything about the nutrition care process or something like that, you know, something, you know, when you look for themes, and you can make decisions. I mean, there could be coaching that can happen, that you can help that dietitian improve their skills, or it might be that, you know, we're just not going to have students rotate with that person anymore.
All right, thank you. So we have a lot of nutritionists and dietitians on this call who have preceptees with them as we speak. And one critical aspect is the feedback you spoke about. How do you manage negative feedback from preceptees without it affecting your professional work towards them?
Yeah, it stings, right, when they say stuff. And you know, I try to first look at, you know, I don't always jump to, oh, well, they're just they're just a bratty kid. They're you know, they don't, you know, they're retaliating because I asked a lot of them, or you know, I try to think about, well, where did that maybe come from? Is it valid? I mean, you know, there might be, you know, there you could get really busy. The criticism might have been, well, she never spent any time with me. I didn't feel like she spent any time with me. And you know, well, maybe I was covering for 2 other dietitians, or I got called down and had to help out the manager with something. So maybe it is a valid, you know, and what I like to do is go back to that person, if at all possible, if they've not rotated out. But I would just like to say, you know, I heard what you said about not spending enough time with you. And I apologize. There was a lot going on. And I'm sorry that you didn't feel like you got the time that you needed. And I appreciate that feedback, and we'll make sure that I don't do that again, you know, with next interns. I think that if you do that feedback, especially that last 10 minutes of the day, if you do that feedback, but you make it both ways, you're giving them feedback on how they did, but then also you're saying, do you have any feedback from me? So that there are, again, no surprises at the end. And then any misconceptions or things, you can correct those right then. Oh, I'm sorry that you thought that I should be with you that for every patient, but really it's important that you start building independence. And with me being behind you every time, that takes away from your confidence or something like that. So you can, that feedback should go both ways. And it also helps show, you know, when you have a student that you just can't, there's always, every once in a while, there's someone that you just are not going to please, right? It's probably something about them, but you're just not going to please them. And so that'll also give you an idea. If you're doing that continual feedback both ways, you'll get an idea about those individuals too.
Thank you so much, Prof. One dietitian is asking whether there's a way they can contact you for information regarding their profession. All right, so you can speak to us, Sarah, and if you need anything, we can connect you to her.
Yeah, I have a new email address.
Yes. Okay. Thank you so much. I think there are no more questions, and I can't see any hand up.
Okay, so Prince, I'm going to pass on. I think what I'll do is I'll put my email in on the first slide of the PowerPoint, and then I'm going to share that PowerPoint with you, so then you can share it with anybody that all the attendees.
Yes, please. Thank you so much. I have a last question here. Can you briefly describe the relationship that exists between training institutions and preceptors, especially in terms of motivation for preceptors?
Well, you know, I take that from a university standpoint. I take that relationship with my preceptors very seriously. I want them to know how much I value what they're giving. And so I do that in ways like those, like the log books. I try to make the log books, the evaluations as user-friendly as possible. I don't want to create a bunch of extra work, busy work. I'm actually in a new position where I'm going to be running the dietetic internship. And I find that I'm seeing that there's a lot of busy work asked of the preceptor. I'm cutting that out because I just don't, you know, I try to respect and show that value to them and their busy time. So, you know, giving them the resources too. So like, for example, what we did previously, we have new competencies in our accreditation standards that we have to teach the students about placing tubes for tube feeding, doing blood sugar checks, blood pressure, swallow. So what we do is, you know, we provide those resources to preceptors, and we brought a bunch of preceptors in for that training. So you know, again, giving them the resources, giving them continuing education. That's really important. That's the 2-day preceptor training that we had before was continuing education. So all of those ways to make my preceptors feel valued, and being there when they have that problem student, they know they can call me, they can pick up the phone, they can call me, and I'm going to be there for them to help with those situations. So that I think is how I try to make my preceptors feel valued. And there's a lot of competition out there for preceptors. And so I want them to feel that value and not, you know, it's like, well, I'm going to always take Dr. Wright's students because, you know, she's always good to us. And, you know, so I think, you know, really trying to get them to feel valued. But the other thing is, I do think that as dietitians and nutritionists, we have a responsibility, regardless, to be preceptors. And because that's how we got to where we are. If people stop being preceptors, our profession stops. So we have to be preceptors. And it might be even in an informal way. A student that, you know, hey, I heard about this field. I'd love to shadow you for a day to learn more about your field. You know, there are formal and informal ways too, but we do have a responsibility for that next generation of dietitians and nutritionists.
All right. So, Prof, in your case, is there any monetary motivation for preceptors?
No, we do not. Absolutely not.
Thank you so much. Yeah, so some Prof has answered that. I've asked this for you, right? Okay. Okay, so thank you so much, Prof. Wright. We are so grateful. And I believe that all those who have been on the call are pleased that they joined. Yes, I've seen some of the faculty members from the University of Ghana, University of Cape Coast, in the Kwame Nkrumah University of Science and Technology, and University of Health and Allied Sciences. I've seen a lot of faculty members and more preceptors from the various general, regional, and teaching hospitals are also on the call. Thank you for the insight you've given us. We are so grateful. God bless you. All right, so Prof, I believe that this will not be the last time, as you've always been there for us. I know as and when anything come up and we contact you, you'll be of help to us. And our greetings to the Academy. We are taking a lot of motivation from you. On behalf of the governing board of GAND, that's Ghana Academy of Nutrition and Dietetics, I say a very big thank you to you for being there for us. Thank you so much.
Pleasure. Thank you. Have a wonderful day, everyone.
Okay, you too. Bye-bye. Okay, so please, I'm putting the link for the last time, the registration link, please. Kindly fill so that we can end the call. I'll be ending the call in 4 minutes. So please, those who haven't filled, I'll just put the form there. Kindly fill before we end the call. Pami. You still full.
RD Prince, please, thank you for the email.
You're welcome. RD Mensa, RD Pamela. Pamela, how are you?
Mr. Prince, I'm fine.
Great. I sent you a WhatsApp. I didn't hear from you.
Yes, please, I'll call you.
Okay.
I'll call you.
Sure.
Thank you.
Sure. Sharon Obong. I've seen you. Thank you for joining. Mr. Teko, thank you for joining. Belinda, thank you. Sewa, how is the baby doing? Auntie Fo. RD Owusu answer. Justice, thank you for joining. Nanama, thank you.
Hello, yes, sir.
Hey, are you
Matthew,
are you pounding fufu alongside?
I'm at church.
Ah, okay, that's great. That's great.
Okay.
Okay, pray for all of us.
I will.
Okay. Right. All right. So I believe all of us have filled the form now. Is there anybody who hasn't filled it?
Oh, I'm also here, boss.
Who? Hey,
It's Kasim.
hey, Dr. Kasim. Hey, I saw that you had left, so I made you came back.
Oh, okay, I think it was the network. Thank you for asking the question for me.
My pleasure. Yes, so thank you too. Harriet.
Yes, boss.
How are we?
We are fine.
I'll come and visit you. I'll come to your
Okay,
place.
because, the private hospitals, we are also here.
I'll come and do some shadowing.
Hey, boss, I hear.
Yeah, the expert. I'll come there.
Hey, okay, come and let us learn from you.
Yeah, I won't say anything. When I come. Okay. Danny?
Yes, sir, I'll talk.
Aha. Oh, yesterday I couldn't join. Please, all of us here, were we all able to join yesterday's CONT briefing? Otherwise, Mr. Mensah is here. You can ask him all the questions. Any question on CONT? The CONT Director General is here. He will answer you. We have 1 minute for your question. Okay, so it's 5:30. Thank you all for joining. God bless you all. Next week, Wednesday, we have another powerful CPD. Please join and learn. Bye-bye.
Bye.